Welcome, welcome. We'll just wait a few moments just to allow everyone to join us, and then we will get started. It's good to see you all today. Okay, so that we don't risk losing out on too much time, I think we can get started and we will allow others to join as they do. Hello and welcome to this long COVID webinar event, which will focus on a community-focused response to long COVID. It's wonderful to see you all here today. My name is Aaliyah. I am Outreach and Insight Manager at National Voices, and I am working predominantly on the long COVID project that we have at National Voices, as commissioned by NHSEI earlier on this year. So we have a fantastic programme for you all today. We're really, really excited to have you with us to share, to listen in into the conversation. And we really do hope that throughout today, you are able to be inspired to recognise that even in the midst of what is so challenging, there is hope for change and to push forward, and also to feel informed by the experiences that have been shared and some of the insight and also the work that we're all doing to try and move forward in this space. So I think without further ado, I can move on to the outline of today. So we will start with some welcomes and introductions. We will then move into thinking about long COVID at National Voices and what we're doing in this space. We'll then have some time for a panel discussion, followed by a few colleagues from National Voices speaking to our work on lived experience and co-production. We'll then have some time for Q&A before we close. So for the Q&A, so that you are aware, you may post your questions in the chat throughout the event, and then also raise your hand via the Zoom function to verbally articulate your question towards the end when we do have the Q&A part of today. I think in the meantime, feel free, as I know people are doing, to say hello in the chat, to introduce yourselves, so that we can all get familiar with who's on the call and who's engaging in our discussion today. Just by way of kind of tech stuff, and I know we're all probably experts in this field by this point in the amount of time that we spent online in this time during the pandemic, but just so that we are aware, on this slide you will see the opportunity to kind of unmute. You will be muted for the duration of the panel discussion and other conversations, but as we say, there will be the opportunity to raise your hand by going to the reactions and then selecting the raise hand button, and then that will mean that you can unmute yourself and then ask a question. If you have any kind of specific technical support issues, don't hesitate to email info@nationalvoices.org.uk, and you can also direct message my colleague Harvey in the chat as well. She'll be able to support. Just by way of accessibility, you will see that the closed captions have been turned on for this event to allow for people to kind of fully engage with the discussion today. The event, as you also will have seen, is being recorded for accessibility reasons and to bring those who are unable to attend today into the conversation. As I've mentioned, please do message my colleague Puff if you have any other accessibility arrangements that will be required. I'd like to give a special thank you actually to our partners at People First, who are the user-led organisation for adults with learning difficulties and disabilities, who have been incredibly willing and patient in supporting National Voices to have a kind of inclusive and accessible approach to our meetings and events. So I would just ask us all today to consider the pace at which we speak, to refrain from using any kind of technical language or jargon where possible. And if you do, if you could explain what you mean by that in a straightforward way so that we can all understand. And ultimately, thank you to you all for working on changing the ways that we work together so that everyone is included in the conversation in these types of events. So I will now hand over to our Chief Executive, Charlotte, who will open for us with a few remarks before we get going with the main bulk of the event today. Thank you, Charlotte.
Hello, and a very warm welcome from me. Thank you, Aaliyah, for this introduction. I've just been looking at the chat and seeing everybody introduce themselves, and I'm very heartened by the wide range of people who are signing up. And I'm also very mindful that many of you who are in this room together now for these 90 minutes with us have very direct experience of long COVID. And I think we need to bear that in mind as we talk about these topics. This is very personal for many of you and for many people out there, and it's very difficult for many of you. And I think we need to hold that carefully as we approach this conversation. I'm going to very briefly talk to you about why National Voices is in this space at all, and then what we're hoping to achieve today. So as a general rule, National Voices doesn't do work on condition-specific stuff. We are a coalition of 180 charities. All of you are experts in a particular problematic, in a particular community, in a particular condition. We are not. And we are not experts in long COVID at all. And I certainly don't have lived experience of it. We are, however, experts in what good long-term condition care looks like and what good holistic support models look like. And so when NHS England started getting going on putting services in place, they reached out to us and asked us to help them think through how we could apply what we know, and that's largely to do with the practice of our members, what it looks like to support people well who are unwell for a long time and might have fluctuating symptoms and might need support with employment issues and money issues and carers issues and emotional issues and so on and so on. So that is our route in. The other thing that transpired, and I hope that you are aware of that, is that we at National Voices have a strong focus on inequalities because we want to foreground the lived experience of people in everything we do. And if you look at the lived experience of people with long COVID, you realize very quickly that inequality is a strong characteristic of those experiences. And one thing that got us worried and that got NHS England worried is that long COVID services at the moment don't seem to reach people who are up against inequality, discrimination, stigma, poverty, and so on. There is the inverse care law. I'm assuming you have all heard of that. It basically says the more severe your needs are, the more disadvantaged you are, the less likely it is you're helped by the services that the system has set up so far. That's obviously a troubling phenomenon, and the inverse care law is alive and well when it comes to long COVID. So the specialist services that have been set up to support people with long COVID are not representative. The people who use these services are not representative of the communities we assume carry the largest burden of long COVID. The assumption we have, and the assumption all the modelers have, is that those communities who were worst affected by COVID are also the ones who are worst affected by long COVID. So it's troubling that they are not turning up in the same numbers in the specialist services. So we got given a small grant by NHS England, and I emphasize small, to work with 6 organizations in turn who have a very deep understanding of the needs and ambitions and circumstances of communities at risk of exclusion. And Leah might talk about that a little bit more, but through that work, we're beginning to understand what services might need to look like and how our sector and the statutory sector might need to respond to the needs of communities who don't just have long COVID, but also are up against other difficulties at times. So this is why we've put this event together, because we believe there is a journey we all need to go on to get long COVID support embedded in communities, diverse communities. Now, this is a small grant. We are a small organization. This is a small event. We are not going to crack all the problems we're going to talk about today. So this is really the start of a conversation. We are shining a light on some of the issues we're talking about today. We want to take our members, who are not long COVID expert organizations themselves, onto a journey so that they have the curiosity and commitment to understand what goes on for people who are affected by COVID in the long run. But we're not going to solve all the issues we raise. And one thing that I think is important to say, particularly since we have so many people in the room who are personally affected, is that we can't here today resolve anyone's individual issues. This is just not possible for us to do. We are humbled and honored and blessed that we have organizations in the room, on the panel and in the Q&A and in the conversation who are very expert on long COVID, a lot of them led by people who live with long COVID themselves. And they will talk later in the event and outline the support offers they have. And I strongly encourage you to reach out to these organizations if there's something you personally need to talk about with regard to your own experiences. That's the beauty of our coalition, is that we can point towards sources of support, even if we are not able to provide that support ourselves. One of the things that's obviously troubling about the situation we're facing is the sheer numbers. I'm not going to unpack the controversy around the numbers, whether we go for the more conservative or the more scary figures. They're all scary. We have had more people acquire long COVID in the last year than people who have acquired cancer. That is a shocking statement, and we will store our problems potentially for quite some time to come. And the really troubling thing, and I'm sure I share this concern with most, if not all of you, is that we are still having really high infection rates, and therefore we are still adding to these numbers at the rate of knots. And I think particularly if you see what's going on for children and young people now, where I've seen some statistic yesterday that said the estimate is now that 1 in 10 children have COVID as we speak. That's 2 or 3 in every classroom. That's just a mind-boggling statistic. And even if only a very small proportion of these young people end up with long COVID, we are adding a really big problem to people's lives. And some of those lives have been quite complicated even before COVID hit. So I think we are having this conversation against the backdrop of very worrying trends, and also against the backdrop that not everybody's experiences are heard about and not everybody's voices are heard. And that plays out on 2 levels. That plays out on the level we are here today. Not everybody is on the panel, not everybody's experiences are surfacing, not all the communities are able to shape the conversation about long COVID. And I think particularly children and young people have had very little say in how we make decisions about the level of infection we're willing to tolerate and the level of long COVID we're willing to tolerate. But I think it also plays out on a very individual level, because one thing that our friends and colleagues in the long COVID organizations keep saying is that people are still being dismissed, people are still not believed, people are not referred. And that is obviously profoundly troubling. And I think also explains some of the anger and some of the impatience people are bringing to our discussions. So I just want to say, we hear you, we hear the anger and we hear the impatience, but I also want to say, I think everybody on this call today comes at this with goodwill and wanting to learn. And if we do say the wrong thing or don't understand something or do not know something that you think is very obvious and everybody should know, it probably comes from a place of innocently not knowing rather than from a place of ill will. So please, let's have this conversation together in that spirit, that we're all coming at this with a desire to make things better, and that between all of us, we have a lot of assets to bring to the table. And let's also focus on that rather than just on the terrible situation we're confronting. I think that's all I wanted to say. I hand back to Alea now.
Thank you so much, Charlotte, for laying that out. And as a team, as a community on this call, I'd like to think that we're all so preoccupied and would like to commit learning to this subject especially. Moving forward then, we're able to speak a little bit about the work that we are doing at National Voices when it comes to long COVID and the kind of groups that Charlotte mentioned a little bit earlier as well. So we are working with 6 key groups who support members of our community who are at risk of exclusion. And then we're also working alongside Hastie UK British Lung Foundation, who are our project partners in this work, as we kind of feed back to NHSE and I as well. So what we're hearing from some of these groups is that there are assumptions that we're making about you know, whether people have the virus or don't have the virus. We need to think about how important it is to create bespoke resources, to centralise the voice of the person, to centralise the experiences of people as well, and to bring people into the conversation much earlier on, so that actually they are laying the groundwork and at the decision-making table when it comes to bringing some of these things forward. We know and can recognise, when we look to certain conditions as HIV, for example, the importance of peer support and peer advocacy. And so long COVID and the groups that we're working with are musing along the same lines also, and are, you know, also speaking to the importance of coming together and that community-focused response, which we will hone in on shortly with our panel. I know we do have a few of our kind of project partners here today, so it would be wonderful to potentially bring them into the conversation later on. But I think it was just really, really important to highlight here that throughout all of these groups, one of which works with homelessness, another with gypsies and travellers, another with adults with learning difficulties and disabilities, another with a deaf group, others with Black and Asian minority ethnic members of the community, that they all have something very distinct to share, but we are recognising similarities as well. And we're hoping that within these groups we can build a coalition to really push forward and advance the case for exemplar responses to such conditions as long COVID and other long-term conditions that we're still battling to manage as well. So I think without further ado, I will move on to our panel now, and I'd love to introduce our panelists for today. As we kind of get them on screen, I would love to speak to their wonderful accomplishments, and then I'll have them to, of course, speak for themselves. So we have with us today Davine Forde, who is a lived experience associate, and Davine has worked with the BCSC sector for over 25 years. She's currently an associate at the Manchester BME Network, CIC, a volunteer member of the Patient and Public Advisory Committee for Manchester Health and Care Commissioning, and a patient partner voice representative on long COVID for NHS England. So Davine is also living with kind of several other long-term health conditions, and is passionate about improving health services. We also have with us today Claire Hastie from Long COVID Support, and Long COVID Support is a charitable organisation focused on advocacy, research involvement and peer support. So it's an online group currently with about 45,000 members, which is incredible. Claire sits on the NHSEI Long COVID Task Force and the DHSC Long COVID Roundtable, and is also an advisor on several research studies and a co-author of multiple papers on long COVID. We also have with us today Michael MacLennan from COVID Aid, and Michael is a founder and chief executive of COVID Aid, which is the UK charity set up to support everyone significantly affected by COVID-19, and to provide a supportive platform on COVID-related issues, including on long COVID. He has been a trustee for Just a Drop, and was a founding member of Click Sargent Innovations Forum as well. He's a communications director for Brunswick and has worked in senior digital roles across BBC, ITN and others. And finally, we have with us today Sammie Mcfarland from Long COVID Kids. So in actually March 2020, Sammie and her 14-year-old daughter unfortunately both contracted COVID-19 and subsequently developed long COVID. And so fueled by some of the challenges in accessing health care, medical care for her daughter, Sammie launched Long COVID Kids to provide grassroots support, connection and advocacy for families, children and young people living with long COVID. So we have a fantastic panel with us this morning. There will of course be an opportunity to feed into the discussion as attendees as well. So do, as you listen in, feed in questions via the chat, or you can hold those questions and raise your hand at the end of the session as well, so that we can bring in our speakers in that way. So hello and welcome to you all. Thank you so much for joining us today, to our panelists. I think where we'd probably like to start, and to paint a bit of kind of colour and context to the work that you are all doing, is understanding what's kind of brought you here today. So why it was important for you to come and to speak to some of that work. I think I'd like to start with Davine, and then we can move through and hear from all of our panelists. Davine.
Good morning, everyone. So why it's important for me to be here is because, you know, as someone who's living with long COVID and other long-term conditions, it's important that the research isn't fully there yet. So it's important that you hear for people's voices from the experiences that they have. Now, my journey with the NHS started a long time ago. My parents were part of the Windrush generation. My mum was a nursing assistant in the hospitals. And the NHS has always been really strongly important to us. My sister's a medical secretary. My other sister became a mental health nurse. So improving health was always a biggie. Back in February 20, my older sister went into hospital. I was also sick, but my GP kept saying to me, well, not my GP practice nurse kept saying, it's just asthma. I couldn't breathe. I couldn't walk. My other sister got ill. And my older sister was in hospital in total for 16 weeks on a ventilator with COVID. My other sister was in hospital for 2 weeks with COVID. So they had a definite diagnosis. I was in the community and my GP practice just kept saying, it's asthma. Now I've lost 3 weeks of my life that I can't remember. And behind me, you can see my granddaughters. The youngest one was born, didn't know she was born because COVID completely took me off my feet. Now, I'm still living with long COVID, trying to get to hospital appointments. Some days are different, every day is different. Some days you can't walk, some days I can, some days my breathing's terrible. And now I've got a host of different long-term conditions. Now, during this time, I was quite fortunate. And people say, why do you say that? Our siblings and I had COVID all at the same time. My brother also had it in the community. So at least we could speak to each other and we could go through it together. Now, when you have COVID or long COVID and you don't get the validation that you need, that is the first thing that starts eating away at you. You want somebody to believe what you're going through. Publicly, it was said this is like flu. It was nothing like flu in my experience. I didn't know if I was going to live. I would literally sit up propped up because I didn't want to lie down because I thought I was going to die, gasping for breath, and didn't know if I would see the next day. Now, going to your GP was very tiring at the time. Of course, everything was shut. And if you're not believed, it's as if you're banging your head against the wall. Eventually, when I could walk, I kept falling over, didn't know what was happening, turned up at A&E. And at that time, no one knew what was happening with long COVID. Fortunate for me, my sister was sent to rehab, so she couldn't walk either, but at least I could speak to her on the phone so I could find out what was happening with her, which then we could, look at our stories and how similar they were. From this, I volunteered with a patient participation group from Manchester Healthcare Commissioning. I contacted the senior engagement officer and said, look, the pathways for COVID are very different if you're in hospital from in the community. If you're in hospital, you get a diagnosis, so people believe people are working on your behalf to keep you alive. If you have COVID in the community, it seems that there's nobody working on your behalf. There's no one sharing a pathway. There's no one telling you what's the next steps. There's no one to believe you. And thankfully, the senior engagement officer's name is Val. And she says, right, Davine, because I didn't have the energy. I really didn't have the energy. She says, right, we'll meet together. We'll set up a Zoom and we will invite people to attend a support group on Zoom. I call Val the validator. Due to her connections, and it's purely from her connections, she can get people into the GP practice. She can contact, consultants. So people who have been going with this disease for 20 months can get somewhere.
Yeah.
We all need help. We need validation. We need empathy, because everything has changed. In the support group, you see people are grieving for the lives they had beforehand because they can't get the practical support they need now.
Mm-hmm.
So I impress on you today. I know we've seen online, we've got social prescribers, we've got researchers, that we're all in this together. No one owns COVID. COVID owns itself, but we've all got a part to play. And if the research is not there, we just need to listen to the people who are suffering daily. So I thank you for listening today. Someone said to me, it's as if I'm a music board. Every day something goes up and another slide comes down. You just don't know where you're going to be at. I'm quite active in my community, so I'm quite fortunate that I've got connections. But if you are someone who has no connections, you are lost.
Absolutely. Thank you, Davine, for sharing that so powerfully and so articulately. And I can see in the chat as well, lots of shared experiences and also kind of sympathy and empathy, going out for that moving testimony. And I think, off the back of that, actually, I'd like to bring in Sammie from Long COVID Kids, because you can see the importance in validating people's experiences and harnessing a community so that people can share together.
Thank you. Thanks for having me today. Yes, so in our support group, we've got over 4,500 families now who are struggling to manage their child's condition, and living with long COVID is hard for adults. I'm an adult long hauler myself of 19 months. I think it's possibly even harder for children, because children have been minimised. Their experience has been minimised since the beginning of the pandemic. Unfortunately, I'm here to represent the families, children and young people who want to ensure that change happens now, and the voice of the child is heard throughout all decisions, policies, support services, and really we want other families to know what our experience has been, so that they will take perhaps different choices, make different choices, and reduce their risk of getting infection and getting long COVID. We know that 1 in 7 children at least will get long COVID. We know that the Chief Medical Officer has said that all children who are unvaccinated will get COVID in the course of time. So really, we do need to think about prevention. We also need to think about how we can support the families who are suffering. We need validation for families. My daughter health experience has been minimized and ignored, and unfortunately that's now taking its toll on her mental health, her confidence, her ability to socialize. Her education attendance is now down to 47%, and she is not unique. We have many children in our support group in exactly the same position or worse. And I'm really here to make sure that children are represented and that they are thought about every single term throughout long COVID. Thank you.
Thank you, Sammie. And as Charlotte kind of alluded to earlier on today, actually kind of children and young people have been minimised hugely. And the work that Long COVID Kids are doing is what's going to shine a light on those voices that have fallen away through media, through even research and studies also. So we hope that a change in the time can come soon. I think that kind of links into Michael, what you've been doing at your organisation around the long COVID kind of project as commissioned by National Lottery. And I think it would be interesting to hear actually today what that project entailed. And I know you brought in some long COVID charities who are with us today into that discussion.
Yeah, certainly. And like Charlotte, I'm not somebody who has lived experience of long COVID, but I think I have a personal interest in the sense that my mum has had fibromyalgia for years. So I've been very aware and very sort of very moved by the stories there. I think being ignored, being underrepresented, not having your voices heard, yeah, it's quite something. So to talk more about the charity, after lockdown, I tried to help as a trustee for Just a Drop. Also help with the Good Things Foundation and Future Talk Now around digital exclusion, that side of things. And I think around Christmas time, like many other people, I was feeling increasingly angry and upset about what was going on. I wasn't sure what I could do. And when I was thinking about how I could help out, then I was looking at other things around. At that stage, there wasn't a charity that had been specifically set up to support everybody affected by COVID-19. And I thought there was an opportunity there because everybody has their own stories to tell. Everybody's been impacted in some way. There's over 1 million people who've had long COVID, but there's many more who've been affected in various ways. So I thought that with my own background in digital and charities and communications, what I could do was try and do something that's a supportive platform. So not to be the one charity that does everything, but to try and complement and boost. Because I could see the NHS, the social sector, so many charities associated with national voices and long COVID groups here have done such amazing things, often for months, for kind of years now, without the support that they should get. I hope that I could help with that. So COVID Aid, basically since having that idea in Christmas time, it's just been a kind of big effort all the time to try and make sure that we get the right people involved at every stage. And I was really fortunate to talk to Sammie from Long COVID Kids, to Long COVID Support, to Long COVID SOS and other COVID related groups early on before forming the charity. So I tried to make sure that in doing so, we could be as reflective as possible. So we have people with lived experience to do with long COVID, to do with trauma in terms of the trustees. We had the expert panel. So our first members were Dr. Nisreen Alwyn, who's received an MBA around her work around long COVID and does amazing work for long COVID kids. I got Sandra from Long COVID SOS and others with all very diverse mix of experiences and stories that they can tell. I think the National Lottery work that we got, we were really fortunate that almost as soon as we launched, there was this opportunity through Catalyst to get this grant. And it was a really interesting project. We partnered with a great digital services agency called Hacktar, Gemma from them. And the idea from the brief was that we would do workshops to provide a digital toolkit. So that includes personas, user needs statements that would help other providers, organizations in terms of the discovery process of trying to think about what people with long COVID are like. We were also really fortunate to then get participants from Long COVID Support, from Long COVID SOS, from Long COVID Kids who took part in the workshops. And there's people here who were on the workshops, so I don't want to speak for them in any way, but I know that from my perspective, it was, again, a hugely involving experience. We learned so much from that. I think we ended up in one place where we had training guides that we provided with for this. It was a pilot project, and it's great effort by Catalyst to try and make sure that we do have that patient-focused approach. But I think we basically junked what we were doing during the first workshop because we realized that there's too much of an us and them dynamic, and that collaboration that I know the other long COVID groups can speak so powerfully about is something that I think needs to be central from the very beginning. So I think we ended up in a good place, but I think there's a lot we can speak about in terms of the amount of effort that people such as Claire, Davine, Sammie have been doing since March, April, the first wave last year. And yeah, I hope this is a good opportunity to do that.
Fantastic. Thank you, Michael. Thank you for being so kind of open and vulnerable in your own experiences or proximity to those struggling with other long-term conditions, and what that sense of gusto did for you in mounting something for yourself, and for others really, and pushing that message forward. I think, Claire, I know you've had quite a few mentions already today without even contributing just yet. So I think anything more to add to the discussion around the importance of bringing people with experience into what it is that's being created by way of solution.
Well, I mean, I think there's probably at least 2 books that I know of that are being written about the role and impact of patient communities in long COVID internationally. The story of long COVID is the story of patients. We discovered the condition, we named the condition, we disseminated and distributed and banged on about it till now that term is used all around the world, even in non-English speaking languages. You've got das long COVID, le COVID long, you've got, in fact, actually, ironically, I think the US was probably one of the later countries to adopt the term because they use the term long hauler, but around the world there are groups called that. Elisa Perigo came up with the name, we ran with it, and we just pushed and pushed, and I don't mean me or we, I mean collectively the community. So the expertise that we have is unparalleled, frankly, because we are living with, well, the fact that we know there are more than 200 symptoms is thanks to patient-led research collaborative. This study that they developed, that we fed into, that we helped disseminate, the collaboration that Michael talked about in the long COVID community, both within each of the individual groups that didn't really know each other existed at the time we all popped up. But we are in, Sammie and I are on WhatsApps 20 times a day. We work really closely with long COVID physio and the amazing team there, long COVID OT, the occupational therapists, long COVID doctors group, the body politic, patient-led, I'm not even listing them all, but and actually our group is a very, very special, I know I'm biased, I'm very biased, but it's a very special place because we moderate it around the clock, helped by we have members in 100 countries, and we have a bunch of time zone spanning insomniac moderators who do a fantastic job. We literally look at every single post and either let it through or we don't, because we are so mindful of keeping this a safe space. As you can imagine, a bunch of very, very desperate people are reaching for all sorts of pseudoscience, Dallas Buyers Club type stuff, and we are absolutely like a ring of iron around them with our professional and lived experience. Yeah, so I mean, I think as it's been alluded to, we are all part, long COVID SOS, long COVID kids, long COVID support have been part of the government, the Department of Health roundtable since its inception. Same with the NHS England task force. There's a meeting about this afternoon. We've helped feed into what the pathways look like. We at Long COVID Support launched a survey at the turn of the year once clinics were officially launched, and we've been feeding back because I think we're in a pretty unique position to be able to capture. I know NHS England has recently started publishing stats about it, but we have this unique perspective because we can reach the people who are not able to access care, who are not able to get referrals when they ask for them, and to understand also what their perceptions, what's happening when they go to these appointments, because we know that they're for the best efforts of the amazing people in the NHS that have rolled out these clinics so rapidly and are doing their, my heart, I'm absolutely grateful. And I don't ever want to seem critical because, we're part of the team that's trying to help get this stuff right. But equally, we need to be mindful, as Charlotte said, of the enormous scale and severity of this. I'm kind of waffling in an unstructured way, but basically, I think long COVID support was one of the earlier groups. I say lots of them sprung up, we didn't even know about each other, but what seems to have kind of emerged as a model is that other groups have set up as offshoots, because we were all together, but then there was a recognition, for example, our friends at Long COVID Scotland, that actually because the health service there is different and the research funding and the government, there was a need in terms of kind of advocacy and working with those bodies to have an offshoot organisation. So we're all still kind of rooted in Long COVID support. Similarly with, Sammie was in my group and worked with Francis Simpson to set up Long COVID Kids, because they recognised, because I guess we're kind of universally trying to sort of get research, rehab and recognition for long COVID and return to work support. And so we have so many members and founders of other groups that were actually came together initially in our group and are still in our group, and they see a value in joining the dots internationally in our group, then they're working their backsides off in Wales, Czech, Slovakia, Austria, so yeah.
Fantastic. Thank you, Claire, for speaking so widely to actually long COVID support being one of the first really to recognise that something more needs to be done in the community space, and you know how inspired we've all been to see other initiatives and other organisations follow suit and also be a part of that journey as well. I think, you know, Davine, actually, I know in your work you come from a slightly different perspective, also, you know, being a Black woman, working with kind of Black African Caribbean members of the community up in Manchester. Do you have anything to contribute to that conversation in terms of how experiences have differed for you in your community in that way?
I mean, there has been within the community there's a hesitancy, I will say, because of historic treatment. A lot of Black people don't want to come forward or are refusing to come forward because they don't think that they're going to get help. You know, we're talking about health inequalities now, but for Black people it's not a story, it's their lives, and this is how they've been treated for a long time. So, you know, we're not seeing them in the clinics, but you know, they don't make referrals themselves. So for me, it's about actually the health professionals need to make the referrals, and if people feel left out, it's because of past experience. So, you know, we've got a long way to go, but this is an opportunity. We need to use this as an opportunity to change things.
Yeah, certainly. And Davine, what's been working well for you in the work that you're doing then to start to harness people's voices and bring that forward?
I think what works well is I know what works well is when we all work together, because at the end of the day, no person can fix this solution by themselves. We've all got something to add. We've all got some value. So what we have to do is listen, firstly, to people's experiences. You know, we have to think about what is the pathway, because there is a good pathway, because some people are experiencing a good pathway. So let's try and implement that in the areas that we don't have it in right now, so that everybody can have the same level of treatment.
Yeah, absolutely. That kind of equality of access and equality of quality to these services also. And I think, you know, I don't know, Michael, actually, if you wanted to come in and add anything more to that in terms of your learnings as to what's worked well in your liaising with long COVID charities and in building a charity from the ground up as well.
Yeah, I think from my perspective, I'm very aware that there's you know, massively diverse range of experiences of long COVID itself, but then a huge diversity in terms of the people experiencing long COVID. I think sometimes you can put those two things together, but I think from the experience of trying to form a new charity, it's trying to get that right balance, and that's something we're definitely not there. We're always trying to do a lot better in terms of adding to the expert panel, adding to the trustees, adding to volunteers and everybody who's involved. And then also definitely in terms of the partnerships and collaborations. I think Claire said about the amount of long COVID groups. I've been trying to make a list of all the COVID related groups in the UK alone, and it's just, you know, I think I've probably got like a small minority of those, but I think it's at every stage trying to have those conversations and involve people as early as possible. So I think, like I was saying with the National Lottery Project, I think that ideally, say if we were applying for that now, I'd like to do that at the very first stage with long COVID groups that were the participants. I think there's still too much of sometimes the supported dynamic, and I think what the long COVID groups here and elsewhere have really shown is that needs to be broken down. I think it has to a large extent amongst the community, but I think there's a lot more work that can be done amongst some of the organisations probably watching this webinar.
Fantastic, thank you, Michael. I think that, you know, embeds that spirit of constant learning and being open to changing and iterating as we move forward with the process as well. I'd like to bring Claire in here, just seeing your hand. I guess, you know, Claire, off the back of that, things that have worked well within your organisation and things that you want to continue doing more of as we move forward in managing long COVID. You're just on mute at the moment.
What an idiot, sorry, I'm having one of those days. I think the fact that those of us, some of those on this call are actually speaking at an event like this is testament to the impact that we've had. We've had Dr. Tedros of the World Health Organization has referenced us by name and commended our work. We work, the NICE guidelines are going to be signposting to our organization, and Sammie's health professionals across the UK and internationally have from the early days and continue to signpost people to our respective websites, because we do what's on our websites, although I have to admit I need to update mine. That's my next job, and then we've got so many things to do. So we're not necessarily polished and slick, but what we do is we share on there the resources that we as a patient community have found useful internationally, and so that people haven't got to wade through loads of stuff. And we update it regularly, and so we are the kind of go-to place for resources, both long COVID kids and long COVID support, when it comes to sort of knowing about the different symptoms. There's no magic wand on there, but the leaflet talking about health inequalities, that we've been very, very mindful of that from the absolute outset. We have a very diverse core team. And this leaflet I talked about, that I wanted to do it back in Feb, but again, it kind of kept going down the to-do list because of other things or illness or whatever. But we're about to launch this leaflet, and actually I'm sure plenty of people on this call would be really helpful to us to help disseminate that, because one of the, and I think someone put in the chat, in terms of health inequalities, I mean, I would actually put children really quite high on that list. I've got 2 children with long COVID, and several of my close friends in real life have children with long COVID, and it's a nightmare trying to get help. So Sammie's work is absolutely invaluable in the team at the long COVID kids, but I would put children as one of the biggest marginalised groups, and I would, well, in fact, frankly, the whole long COVID community, you could argue. And I would say that that is still an issue. As Charlotte said, cases are going through the roof. And if you look at the breakdown by demographic, it's our precious innocent children who are being exposed to this. I'm getting one of my sons checked out for seizures that he's developed since long COVID. I've had several of my friends' children's lives actually had life-changing, and there's no prospects of recovery, who knows? Which is why all our work with researchers is so important. But yeah, back to what I was asking, if this patient leaflet that we've designed, I designed it back in February. I was sitting in a food bank because I was volunteering for them at the time as well. And I said, I really, really want us to help get this message out, because I think a lot of people won't even realise they've got it. So they'll go, well, why have my joints suddenly started being in agony? And why, my friend said this to me, she said, why have I used to have a stomach of iron, but I've had diarrhea every single day ever since I had a nasty cough in March 2022. Oh, and by the way, my hands have also developed tremors, and I'm getting a brain scan. It's like, right, okay. And I'm not saying it is long COVID, but it could be long COVID. So we're working with an organisation, Pharma Doctor, who distributes to community pharmacies around the UK. We're working with NHS England, with NICE, and with charities who I happen to have personal connections to through food banks, carers, care homes. We want to get the message out. It's going to be launched in the coming days, we hope. And we would really ask anyone on this call to share our patient leaflet in your WhatsApp group, in your Scrabble clubs, or whatever you're doing. And the idea being to get out there to people who don't know they've got it, in your church groups or whatever. So please help us. info@longcovid.org if you've got ideas for how to help us disseminate, or follow us on Twitter. Thank you.
Thank you, Claire. It's important that we circulate these information resources that are built by people living with what it is that we're talking about. So I think, there's been a lot of activity in the chat, and I'm sure lots of connections will be made offline as well. Just, as Charlotte mentioned, this is the start of a much larger conversation. Sammie, I want to bring you in here kind of briefly as well, before we begin to close off this panel, to I guess reflect on what's been working really well for yourselves at Long COVID Kids and what you want to keep doing more of.
Thank you. So our peer-to-peer support group is an absolute lifeline for families who are experiencing that their children's health experience is minimised, and have found it difficult to get validation for their child's condition. It's also a fantastic resource for being able to have that peer-to-peer support, sharing tips, and knowing that there's going to be somebody there, mostly like Claire said, 24/7, who can actually you know, go through what they've experienced and share what worked for them, maybe signpost to other resources that they found helpful. We have a group of moderators who also play a part in that. We're very lucky to have the support of 2 brilliant occupational therapists who hang around in the group at various times during the day and can provide some sort of more professional support. And we really hope to be able to gain funding to be able to provide that more professional support on an ongoing basis. Our website now gets a hit on it about every 45 seconds, which is a phenomenal amount of traffic coming to our website, which we're both excited about because it means people are finding out about us, but also really sad that that our resource is needed so crucially. And really sadly today, the ONS data came out to say that there are now 69,000 children suffering with long COVID that, you know, that we know of. And as Claire pointed out, there will be many others who don't yet realise that they have long COVID. That's a 30% increase in 1 month. And it's utterly horrifying, the figures now. And I'm really concerned for our organisation about how we're going to meet the demand. And, you know, we're working really hard on trying to improve our resources, on trying to create the infrastructure now so that we will be able to work with the increased demand as it comes through. But I think I just really want to kind of get some of the great stuff that we're doing in, because I kept it short on the intro. But we have a 80-page awareness pack which we have for schools to raise awareness of long COVID and also prevention, and talks about ventilation, mitigation measures that we should all be thinking about in our homes, but also in our schools, so that we can reduce the risk of long COVID. We are working on the clock study, the NIHR paediatric funded clock study, to try and further the understanding of long COVID. And I'm really proud to now be working with them to hope that we can give some further input on how they can improve their methodology. We are campaigning for an updated symptom list to raise more awareness so that people who have COVID actually understand when to get tested, when to isolate, because at the moment, unfortunately, the UK only has 3 symptoms. And if you look at the CDC website, who reference long COVID kids as a resource, you'll see that they have 13 symptoms listed on there.
We are since March 2020.
Yeah, we also represent children at the Long COVID Task Force. We attend the Ministerial Roundtable each month, and as Claire mentioned, will be referenced in the Nice Living Guidelines, which I think is a huge testament to the work that we've done in raising awareness for children. And we've recently written to the schools in England to ask them if they've received the CO2 monitors that the Department of Education has promised, which would actually help to reduce the risk to children, and to also ask them what the infection levels are like, whether they're getting the support they need, whether they're getting the test and trace support that they need, because we're really concerned about the growing numbers. And we already know that support services are in high demand, long waiting lists, difficult to access. We're really concerned as the need increases, what that's going to look like going forward for the families that already need the services and the ones that will need it in the future. And we're also really lucky to be working with some brilliant researchers around the world who are researching the many different impacts of children, the impact on the family, the impact on the brain, impact on education, the impact on day-to-day living. So I think in terms of what I think we're doing best, at the moment, it's that peer-to-peer support, networking, raising awareness. And I think that there is so much opportunity to collaborate and to co-produce to make sure that patients are represented throughout everything that happens going forwards with long COVID. Thank you.
Thank you, Sammie, and lots of activity in the chat there, just kind of reflecting on what you shared. I think ultimately we need funders, and we need kind of the money and the resource to be able to meet the demands, you say, Sammie. We can move the puzzle pieces, and we can do all we can to support people on the ground, but we also need that financial gap filled as well. So hopefully, actually, as we move forward and look forward to a new calendar year, we can begin to see long COVID on the table and remain high on the agenda. And I think the final question that I have for you all really is, what one thing you'd like to see happen in the next 6 months on the long COVID agenda to continue to push this forward? And I will encourage you to keep it short, so maybe only a phrase or two each, but maybe if Michael, you wanted to go first, and then we can hand over to Davine, and then maybe Sammie, and then Claire.
Sorry, I didn't quite catch you there.
No worries. The question was, what is one thing that you would like to see on the long COVID agenda in the next kind of 6 months being pushed forward?
From my perspective, I think awareness. I think there's been such amazing efforts made, especially over the course of this year, and I've seen the development of that. But I think when you look at the newspaper headlines, and when you, in terms of Nazreen and the work on Count Long COVID, I think there's still such a, and what Sammie's saying about long COVID kids, I speak to so many people who have zero idea of this still, which it's alarming, like highly alarming. And I think that the more we can do to just try and change that narrative, the better. And I think it's not going to be easy, and I think it's going to be a really tough winter, unfortunately, and it's shocking. But I think the more we can do to kind of push that forward, the better.
Thank you. Davine?
So for me, it would be practical support for both, the patient or the person suffering, but also for families, because actually everything can't be done by health professionals. And I do think that more practical support, so families who are living with this on a daily basis, can provide that help to the person that's suffering.
Thank you, Davine. Sammie? We're just on mute at the moment.
Sorry about that. I would just like to make sure that children are considered throughout all support services, policy and decision making, and that children are considered as a separate entity to adults in terms of data and awareness. I think that's so important because their experience has been completely minimised, and so many people still think that children are not impacted by COVID and by long COVID. And as Claire said earlier, that we are a minority group that need representation. We need a louder voice, and we need funding so that we can achieve our goals, of which our charity has many. Thank you.
Thank you, Sammie. And Claire, final word from you. Anything kind of different to add to what's been shared already in terms of what you'd like to see?
I could say it in 2 words. I could say prevention and cure. And if anyone wants to give us lots of funding to help with those, we know exactly what we want to be done. And we're doing it, what Sammie's organisation has done in long COVID SOS and long COVID support, and our counterparts in other countries and nations have done, is phenomenal. We know exactly what we want to do. We've got the networks to do it. We need funding and we need resource.
Absolutely. Thank you all today, actually, for kind of bringing forth what it is that you have done, what it is that you have experienced. And I'd like to thank, everyone on this call really for holding that safe space for us all to be able to explore this, and to be quite open in what it is that we hope for in this space as well. I think that was a really rich discussion, really excited by a lot of the work and activity that is going on in different ways to support different groups, all to come together really with a shared aim for, as we say, Claire, kind of prevention, cure, management and support as well through these difficult times. I'd like to actually now hand over to a couple of colleagues at National Voices who really understand the importance of lived experience, who really understand why bringing people along on the journey when it comes to co-production, and namely strategic co-production, makes the biggest difference to the changes that we want to see. So I'll just reshare my screen, and I'd like to invite my colleagues Rachel Matthews and Keymn Whervin to speak now.
Great, thank you very much, Leah, and thank you for bringing the slides back. Keymn and I co-lead some work together in National Voices, and we'll just say a little bit about that because I know people will be keen to get to the question and answer session. I just wanted to start by, first of all, acknowledging the courage that it takes to bring these personal experiences into the public domain. I've heard a whole range of different emotions from the panelists and from within the chat, great fear, sadness, loss, anger, confusion, but I've also heard a lot of resourcefulness and a great resolve to work together and to collaborate and to make sure that lived experience is central to that work. So I just wanted to say a little bit about, from the National Voices perspective, how over the last sort of 12 to 18 months we've been really reflecting on this as an organisation, and as you know, we're a coalition of charities. The lived experience is incredibly important to us, and we're learning how to work with this better. We want to be really clear about what we mean. It is people's direct personal experience, so speaking directly to people, not speaking for them. And we want to work from a place of co-production, and I'm sure that's a word that some people may be familiar with, but sometimes it gets co-opted in all sorts of different ways. But from our point of view, it means about working inclusively. It is coming from equity. It is thinking about how we do shared decision making and how we own the work together at all levels, and especially strategically. So we just wanted to sort of make that sort of statement today, is that these things are very important about how we work as an organisation with our members and with you, and I can see that coming out in the chat. If we could just move to the next slide. That'd be great. We just wanted to say here again about you know, what matters at National Voices. This is run through our organisation over a long period of time, but through long COVID, it's become even more important. You know, the sense of personalising care, attending to what matters, not what's the matter, how we can reduce harm, how we can work with expectations, how we can understand that so much more importantly, and recognising that one size does not fit all. And I can see that in the testaments that each of the panellists have brought, and also what I've seen in the chat as well. So it's really important that we do the working with. And we know that people with lived experience, I mean, absolutely borne out by what we've seen this morning and heard this morning, is bringing such incredible, valuable insight and knowledge. We can't get all the pictures, all the places of the pieces of the jigsaw together unless we work with. And in a moment, I just want to hand over to Keymn, who has been working with me on this, or sort of around the work that we do generally in National Voices. And Keymn, do you want to say a little bit around sort of your role and how that we sort of do that leadership and the different roles that you can perform with us as an organisation?
Yeah, absolutely. Thank you, Rachel. Morning, everybody, and thanks for having me. My name's Keymn Whervin. I'm what they call a lived experience advisor, and my lived experience is of being a carer. So I've cared for my mum for 21 years. Sadly, my mum passed away last year of COVID. So although I haven't got experience in long COVID, I did go through an experience of my mum having to go in hospital. So yeah, I've been working with Rachel since last year, and my role really is to embed strategic co-production. I started off with the advisory group, and then we developed some different ways we could embed strategic co-production. Could we move on to the next slide, please, Alea? Yeah, so we started off and we were looking at different ways that we could embed strategic co-production. And the 6 things that came up were people being volunteers, people being researchers, mentoring senior management, reverse mentoring or reciprocal mentoring is what we like to call it. We've had Voices for Improvement members actually become associates, and we're developing them to become patient leaders, and also have other paid system roles. And one of those could be something that's called a co-producer. So that's people with lived experience coming and co-producing some of the work that we're doing. So why is strategic co-production so important? It's really important just so policy and services are actually fit for the purpose of the people that need to access the services, and also fit for the purpose of the communities that we're developing and that we live in. And as we all know, that one size doesn't fit for all. So the process of strategic co-production needs to be a facilitated process, and it needs to get buy-in from senior management. So it also needs to be resourced, and that same, I can hear that commonality coming through what the speakers have said earlier. We need people with lived experience to be on that, have the opportunity and to be supported, to be in a room, so it's on a level playing field and we can be heard and we can actually be those decision makers. So one of the things Rachel and I are doing is we're co-leading the work. So from the beginning to the end, it's been a co-leadership, and we've got a learning partner, UCL, and they're actually looking and evaluating what does it look like for somebody with lived experience, myself and Rachel, to work together. So hopefully on the 9th of February, we'll have more insight to what our journey has been like, and that can benefit and actually prove why people with lived experience should be in the room. Just an example of how people with lived experience, when they're supported to work at a strategic level, what can happen is it also supports them personally. So for myself, being involved, I had a personal budget for my mum, and through learning more about the health and care system, I was able to, number one, save on finances, and also direct myself. So by having a personal budget and choosing the care that I needed and not being told what care I had, I was able to save £18,000 and give it back to the system and be able to just lead a life for my mother and myself. So going back to what Davine, Sammie and Michael and Claire were saying, this is the opportunity to really work on how we embed co-production at a strategic level, and we become equal partners, and hopefully our voices get heard.
Fantastic. Thank you so much to colleagues Kem and Rachel there for speaking so passionately about the importance of putting these things in action, isn't it? It's not just speaking about bringing lived experience into the room, it's actually doing it, and we've been able to kind of mirror that a little bit in our own work, but we're now thinking about what that looks like on a wider scale as well, and particularly pertinent to the conversation of long COVID, you know, doing things about people with people, as opposed to, you know, bringing them in later on in the game. So thank you so much for that. I know now everyone must be really, really keen to move on to the Q&A part of today. So I will re-invite our panelists back to the discussion, as well as Rachel and Kem as well, if anyone had any questions directly to do with lived experience and co-production and how we emulate that at National Voices and want to see that being moved forward, then we can bring those questions in also. I know we had a few questions in the chat as we moved forward, so I will just kind of bring a couple of those back. And I think mainly the first one that springs to mind at the moment is the question from, we had a question from Paulina for long COVID kids specifically. So she's just mentioned the shocking stats around 69,000 children living with long COVID being horrific, and the 31% rise being directly related to people, also to schools kind of reopening without masks and kind of exposing children to the virus. So, you know, she's saying that they've shouted from the rooftops and feel like not being heard. What else do we think we need to do to get heard as soon as possible, really, to stop more children and adults suffering? Can I then bring in Sammie from Long COVID Kids to speak about that? I know you've kind of spoken about more funding and things, but even on an individual level, what people can do as well.
So the first thing is a great question, and it's such an important question because there's no cure for long COVID, so we need to work on prevention. So the first thing people can do is write to their MP and direct them to our resources. Download our school pack from our website. It's a free resource, and it's there to empower informed decision making. It's all referenced for the reader's benefit and ability to check the sources of all our information. It's all evidence-based. Send it to your MP, send it to your school. As Claire was saying earlier, post it in your Scrabble group, post it in your parents group, you know, put it up in your village hall, whatever you have to do to get that information out there. And in that pack, you'll find all of the information about the importance of ventilation, the mitigation measures, why CO2 monitors are important, what the levels of the CO2 monitors should be. It talks about why mask wearing is important in schools, the types of masks, how to wear a mask, when to wear a mask, why you should wear a mask, what you can do if you can't wear a mask for whatever reason. And it looks as well at the symptoms of COVID and recognizing them, when to test test and the importance of testing, because as we know that while you can have access to support services without having a positive COVID test, if you have long COVID, it's so much harder to get diagnosis and to access services. So getting a test if you do have COVID is really important, just in case you do end up developing long COVID in the future. You will then find it much easier to access resources and support services. And lastly, just be aware that the pandemic isn't over, and that there's an opportunity to reduce risk by talking about it everywhere you go, standing in a post office queue, and just continually raising awareness. Thank you.
Thank you so much, Sammie. Lots of takeaways there, lots of things that we can do on an individual level, and mobilising local government as well, which is really, really important. I will invite others also to raise hand via the raise hand function if you did want to be brought into the conversation and ask any questions. I can actually see that Stuart here has his hand up, so if you wouldn't mind sharing with us, Stuart.
Yeah, I'm a retired GP and my wife has long COVID. What concerns me, what you're talking about, is that if people have the symptoms of long COVID, they're non-specific. And therefore the problem is, at times, we're in danger, I think, of missing some serious diagnosis in people. This is what bothers me more than anything else. It's the same as people who had chronic fatigue syndrome. There's not anything you can diagnose. And we're looking at groups of people like children, where what test do we put them through to exclude something more serious? And also with adults. I mean, my wife had to have a brain scan and had to have a CT scan of her abdomen, ruling out more serious things. And I just am concerned about the amount of resources needed to actually make sure that people have not got other illnesses, and particularly with children. It's difficult, you know. People are tired for a while, or the symptoms are so vague. You know, I'll be honest with you, I thought my wife had she had a horrendous rash, and I thought she had some underlying malignancy, so she's had to have all the tests. Just think there's a danger for the public if they put all their symptoms down to long COVID, and it's really up to the doctors and people like that to make sure with the resources that basically it is long COVID. Yeah.
Thank you. I can see Claire would like to come in and respond to that, and then I can pass over to Sammie as well.
I agree entirely with you, Stuart, and as I know, Sammie and Long COVID SOS and we and probably others fed into the NICE guideline, and that's one of the biggest issues, and it works both ways. Some people in our support group are desperate to have a diagnosis of long COVID, because it means that they might get to a long COVID clinic, although if they saw the results of our survey they might be less excited. Others don't want to be diagnosed with that because it's actually, you could miss serious pathology, not least because there is evidence from other viruses and emerging in long COVID that long COVID can actually trigger other pathologies. So with it, whether it's reactivating other viruses like EBV or shingles, we've seen links in our group potentially to cancer. It's probably too early to say for long COVID, but we know from other viruses that there are definite links between viruses and cancers, etc., etc. So we're seeing all sorts of things that are going to be ignored. So maybe if someone has long COVID and also something else, you know, diabetes is another one that's being diagnosed, they might then get stuck on a very long waiting list, which we know from our survey can be, well, it can be up to 10 months for some people, even longer. In the meantime, they may have a tumour growing. You know, they're being told, oh, it's all just long COVID, and I don't use that word, like I would never use that word, but that's what some people are told is long COVID. So it's a very, very serious issue. One of our trustees, Professor Danny Altman, is a respected immunologist at Imperial, and he has NIHR funding to try to hopefully identify a diagnostic tool for long COVID, precisely for these sorts of reasons. But even then, frankly, it wouldn't tell you necessarily whether you've got long COVID and something else. So it's incredibly complex.
Thanks, Claire. I don't know, Sammie, who wants to add anything kind of different to what Claire shared there.
No, Claire summed it up perfectly. Essentially, we just need to make sure all of that.
Absolutely, thank you. And just looking at a few other questions that had come through in the chat as we were discussing, we had Elena ask, how can the voices here break through the misinformation that the anti-vaxxers and their leaflets are pushing out to people right now? I don't know whether, and again, hands up from the panel if you'd like to come in on this. I can maybe speak to Sammie first, and then also maybe Davine, if you could come in and speak about how in your own group you're trying to foster safe information, safe space to ensure that people are properly informed. Sammie?
Funding. We need funding so that we can actually action our goals and our ideas, and we need representation from larger organisations. We need people who have larger platforms than we do to be speaking out, to echo and showcase the work that we're doing, so that we can ensure that our voice is louder, so that misinformation is suppressed. And it is a huge problem, and it's something that our moderators have to work on incredibly hard in the groups. And I know that happens across all of the other groups as well. It's a huge problem, but it's a great question. Thank you for asking it.
Thank you. And Davine?
Well, what we do, we encourage people to ask questions, because, you know, that information's out there. But we do encourage people to ask the questions that they need to have answered, because unfortunately we're not going to stop the anti-vaxxers, but by sharing our experience and letting people know that actually this is real and this affects people in a variety of ways, and by coming together and sharing experiences and people seeing the amount of people that are living with this and are going through what they're going through, that message we hope will be amplified. But, you know, we say to our peer group, check, come online, check. You know, we as Claire and Sammie and others, we're working with the NHS England because we're trying to get the right information out there so that people have a platform where they can go to. You know, we do, you know, refer people to long COVID support for information. We have to share the, you know, the appropriate outlets that are there with the right information, and that's the only way we're going to surpass the anti-vaxxers and everybody else who are scaremongering, because it is about scaremongering.
Yeah, absolutely. Thank you, Davine. I think just for time, Claire, we'll just move on to a question that I know has popped into the chat from Michael, about whether COVID Aid could offer grant writing services to help patient-led groups to get funding. I know as a new charity, you secured that really successful funding quite early on. If there's any help resource for others trying to do a similar thing.
Yeah, I think that's a good question. And I saw an earlier question around the attribution of income and payments and that side of things. I think there's a real need to make sure that when doing applications, in terms of collaborations, doing co-applications and trying to make sure that you do that from the very first bit. So like in terms of the grant side of things, like I'd definitely love to do more, like start to speak to some organisations out with long COVID around doing co-applications. I'd love to do loads more of those, because then I think you can get all the kind of different talents of different groups on board as well.
And how has it been for you actually, Michael, now that you're off mute, kind of working with ambassadors and people in your space who have long COVID? Because I know a question has come in which we will address about, you know, employers or just working in the space with people living with this longer time condition.
Yeah, I think that question, it taps into a lot of my long running thoughts around the charity sector, which kind of, like I said at the beginning, around the divide between the supporters and those being supported and the saviour syndrome and those types of things. So what I was really keen to do when forming the charity is make sure that, like I said, we had lived experience and different experiences throughout the panel, throughout the board. But part of the idea of the expert panel is that then myself, the charity, would then be answerable to a range of other voices as well. And what we've tried to do is make sure that then volunteers, ambassadors, all have the opportunity to make sure that it's not a case of being kind of top down. We want to kind of reduce that us and them dynamic as much as possible.
Absolutely, thank you, Michael. And I think, you know, that's probably a good place to hand over to Claire to answer that question that I know came for Claire from Kirsty Stanley about what employers, and particularly even the NHS as an employer, can do to support employees with long COVID.
There's a lot that employers can do. So I think I can't keep up with the chat and listen and talk at the same time. So I'm sorry if I'm missing things that are in the chat. I'll have to have a read afterwards. But so it may have been mentioned, but Long COVID Support has a dedicated employment subgroup chaired by Leslie McNiven, and with some fantastic expertise in there. And we have co-developed materials with the likes of the Society of Occupational Medicine, work with the DWP, work with the TUC and CIPD, and lots of other acronyms to do with employer bodies. And we, I think we know what we need to do, but it's resource. We do talk to employers. I know that myself and another one of our members who has he works in the police, Barry Calder, he has an amazing, what he does in the police force, his police force and for the police fed is amazing. And we went and talked to the West Midlands Fire Service the other week, and we need to do a lot more of that to educate employers about what they can do, because we see the good, the bad and the ugly, and there are learnings, and I'm fortunate to have a very supportive employer, and I've shared what they've done with me, but I'm very aware that I'm in a minority actually, and that lots of people are losing their jobs. So again, it comes down to funding and resource and help from other organisations if they have a way. Back to what I said earlier, please help us. You know, back to the anti-vax question. Like I said before, Long COVID Kids and Long COVID Support, we have this co-branded leaflet just on the verge of being able to press send on. Please let us share it. I'd love it if National Voices wouldn't mind disseminating it to all your members, because people who work in other charities, people who support, you know, I was talking to a charity yesterday that works in accessible cycling, and I said, well, your members must have tons of people with long COVID. I was talking to a care charity this morning. They must have tons of people with long COVID. Everyone, I mean, one of the biggest ways, sadly, to convince the anti-vaxxers is that more and more of them are likely to get it at this rate.
Yeah, absolutely. That is the saddest thing. And I think, you know, we're coming into a knowledge now, but more needs to be done, as you say, with more money and more kind of support in that way. But I think, you know, lots of activity is happening already. And I'm really glad, Claire, to hear that you have a supportive employer who, on the whole, has been able to kind of take on what it is that you're dealing with and ensure that you can still contribute as best you can to what you're doing. Not the story and not the case for everyone. I think just one final question that came up for Sammie from a colleague actually, in light of the recent news about the vaccinations for under 12s in the US, you know, and children being obviously an overlooked group as we've discussed. When you expect maybe vaccines to be available for the younger groups, and how that feeds maybe into what you're hearing on the ground at the moment in terms of, you know, whether people are up for that.
Okay, that's a huge question. So Long COVID Kids is pro-choice, and we have a mean age in our group of 10 years old, with our youngest member I know of being 6 months old. So, you know, the primary age children at the moment that aren't offered the vaccine are obviously a huge at-risk group. I know that America has obviously just started offering it. I know that in Cuba they're vaccinating down to 2 years. So I wish I had a crystal ball. I hope that this opportunity will be offered to primary school children, and I would urge any parent here or grandparent or auntie or friend who has a younger child to encourage children to wear masks to school. It's their only level of protection at the moment. So until the vaccine is available, that's the one thing that we can each do is wear a mask. Thank you.
Absolutely. In some small way, we can move forward to protecting ourselves and other people, especially within the context of children and young people as well. Thank you all so much for your contributions. Thank you to attendees also for your wonderful questions. We weren't quite able to cover them all off, but there will be a kind of feedback survey circulated in the chat by a colleague afterwards, in case you do want to forward on any questions. And you may, of course, also get in contact with us via info@nationalvoices.org.uk as well. I know there were a few questions floating around about whether this meeting will be recorded. We will be recording, or we have recorded this meeting, this event, and we will be distributing it afterwards as well. So there will be the opportunity to reflect retrospectively. I would just like to finally bring in Charlotte again, just to kind of round off some of the discussions and maybe leave us with a few key takeaways that you've heard as we've made our way through the discussions today. Thank you.
Thank you, Leah. What an interesting and important event. I think you've asked me to kind of pick out 3 key things I've heard, or I think I'm taking away from this. You might be taking different things away. In fact, I think this is a good exercise for all of us to sort of think, what are the 3 things I've heard? I think I would answer on 3 levels. One is, for the NHS colleagues on this call, you must have picked up the amount of energy and hard work and commitment and innovation that is going on in communities to respond to the challenge of long COVID. The problem of long COVID cannot be solved by the NHS alone. And by that, I'm not letting the NHS off the hook, or researchers, or the statutory system, not at all. But I do think it is so obvious to me, listening to the conversation we had here, that we need to find a way of building pathways, building service models that straddle formal services and the community. Because just listen to all the work that's been going on, all the assets that have been created, all the support that's been stamped up. You would need your head examining if you were ignoring all of this and just marching on in splendid isolation, frankly. Do work with your communities. Let's learn from good examples where this has happened. Let's get peer support into our care models. Let's get peer advocacy into our care models. The energy that's got us to this place will get us so much further if we combine with the power of the statutory sector. So that's my first takeaway. My second takeaway is maybe more about the people on this call who are from the sector that I work in, and the people on the panel are working in. And that's about the solidarity we've heard today. And I think that is something that we as a sector need to get better at, and we need to make more of. We need to join the dots. We need to bring things together. We need to share each other's outputs and assets and events and people and support each other. And I think we've heard a lot about that practical solidarity today, and I'm really heartened by that. And then my final point is just maybe for everyone on this call that I feel we've talked about quite deep feelings, and there is a lot of sadness and anger and exhaustion, and a lot of us are tired. Sorry, I'm feeling a bit emotional saying that. And I think we need to go gently and spend the rest of the day just maybe reflecting on this and giving each other time to heal, and ourselves. Thank you.
Thank you so much, Charlotte. And I think that does reflect, that sentiment does reflect of togetherness and wanting to be vulnerable in this space and create a safe enough space that we can really move forward with that feeling. We can't lose the feeling in the fight. I think sometimes that happens when we're just so passionate and we just want to see the end goal, that we lose the feeling behind why we do all that we do. Thank you so much all for joining us today. It's been really insightful to hear from all speakers and to hear from the attendees as well. And we hope to be able to follow up with you all in due time with the resources and the kind of recording of this event as well. I wish you all a wonderful rest of the day, and we'll see you soon. Bye-bye.